ever since the dawn of time, the humans haven't really changed. We all have brains and necks and heads, and we all have headaches. And even as far back as 7,000 BC, I don't know what they did. They probably grunted and pointed at their head, and that meant headache. But they used to punch or drill holes in people's heads. As that evolved, people was like, that was because, the demons. You got the devil inside your head. We need to get the devil outside your head. And they used to do what's called trepanation. I mean, that obviously did not work too well, right? Or otherwise we'd be doing it still. And even as late as the 17th century, people were suggesting that. So, I mean, for thousands of years, and they were still suggesting it in the 17th century. And Dr. William Harvey, brilliant man in the 17th century, he said that it's not the liver, it's actually the heart that pumps the blood. So he figured that out, and he was still saying, we need to drill a hole in your head. So we've come a long way. Let's go to that. And Hippocrates, he's the father of the principles of medicine, and we all took his oath, the Hippocratic Oath. He even suggested it. But he was also very observant, and he noticed other things, like when people, even back then, 400 BC, were talking about having bright lights flash, and then all of a sudden they have a really bad headache and they get nauseous. He was talking about a migraine, even back then. So the headaches and the symptoms haven't changed, just how we perceive them. And he even thought that, when you get a really bad headache, do you get nauseous, sir, when you get a really bad headache? So if you're nauseous, you're not eating awesome pasta and bread and salad, so your stomach's empty. And then if, God forbid, you should happen to vomit, only just, well, I probably shouldn't talk about that. You guys are eating dinner right now. But it's all green. And so he said, oh, that's the bile. Oh, it must be the bile vapors coming up and causing headaches. So, I mean, at least he tried to think outside the box, but we've come a long way. So ever since then, we've been able to do a lot of research. And headaches are very common. Most of the population will report at least having one headache in their lifetime. And 40% of the headaches that are reported are said to be severe and debilitating. And a lot of people go to the emergency room if it's 2 in the morning and you're nauseous and you have a terrible headache and ibuprofen didn't help and ice, you go to the emergency room. And it's actually the 9th most common reason to see a doctor. So it's very important, it's very common. What do humans do when we see something that big? We create international societies to study it more. So what the International Headache Society has done, and it's a collaboration of the EU, the European medical societies, and the North American and South American societies, and they classified headaches starting in the mid to late 80s. And okay, so they started classifying them with as much knowledge as they knew back then. People describe like a vice squeezing their head. Okay, they're like, oh, that's tension type headache. And that was the one that it starts in the back of your neck and it comes up to the front, and before you know it, it's affecting your vision and your eye. Well, that's good, they classified it, but after a decade, then they said, you know what? It's probably not the muscles squeezing the head. So, okay, but they still call it tension headache, even though now they're trying to get away from that name. We'll figure out, I'll talk about what's the cause in a moment. So migraines, everyone knows probably someone with a migraine if you don't suffer from it yourself. And they're terrible, they're horrible, they are debilitating. And the most severe ones are the ones that have the aura, usually. But you don't have to have the visual changes or numbness and tingling in an extremity or weakness right before a headache for it to be a migraine. Although that is the most, the aura. So an aura is the sense that you're going to have a headache. So some people have that even with seizures. They know they're about to have a seizure. And the symptoms vary from flashing lights or seeing things float across your vision to this will start getting numb and tingling, or some people talk about like hearing swooshing in their ears, even though that's also a symptom of an aneurysm, right? So those are all things that might come right before a migraine. So people know that that's coming. If you're lucky enough I guess to get that signal, you can take a medication to stop it, hopefully, before it comes. Although, if anyone's tried those medications, they don't work that well. I'm going to explain to you why, too, in a little bit. So for decades, we thought it was, it has to be the blood vessels, the arteries and the veins spazzing and flexing. And so they prescribed medications for that. It turns out that they don't work so good, even though we still use them, although they probably work only a quarter of the time. Now they're thinking it's not so much the blood vessels, but it has to do with the nerves, which makes more sense. The brain is a giant ball of nerves. So we're kind of going in that direction, and there's new medications coming out directed at the nerves. We'll see how well they work over the next decade, too. But as much as we've learned about migraines, it's still evolving. Our knowledge of it is still evolving. And just recently in 2010, we already talked about you get nauseous if you have a really bad headache. So the two most common symptoms of having a migraine is visual changes as well as nausea. So Calhoun and his colleagues, they wanted to study if indeed those are the most common symptoms, or neck pain, because in their clinic, in their practice, everyone complained of neck pain at the same time as the migraine. And they actually studied over 2,000 migraines in over 170 patients recorded over a year, and which is a lot of migraines, unfortunately. And it turns out neck pain is the most common. So how many people here get a really bad headache and their neck hurts? That's me. I mean, when I'm at work all day, I get it. So they proved that, and this is basically why. While our knowledge is changing, anatomy doesn't really. But then our anatomy hasn't changed in, I don't even know how long, eons. But we have even discovered new things about our anatomy recently. In the late 90s, by accident, basically, someone discovered that some of the neck muscles at the base of the skull actually have fibers that go and attach to the sheath that's around our spinal cord. He does that in the office too, like all the time. But this is what so that's the zoomed out view where you can see the muscles, okay? And if we zoom in here, you can see these are the muscles at the base of the skull. They help control the skull a little bit, but they also provide a lot of feedback. Where is our skull in relation to our neck? And you can see these guys have little sheaths and fibers that come and attach to this saran wrap around the dura, which is the sheath around the spinal cord. So if these get really tight and they start pulling on this, it's going to cause a problem. Miss Kim.
It's those two muscles that look like baseball bats?
These guys.
Yeah. Is that leading to the ears?
No, this is your first vertebra in your spine. That's the C1 vertebra.
Okay, so it's underneath the head.
This is the C2 vertebra. Yeah. So it's underneath your skull. Okay, and that's your spinal cord right in there. Okay, this guy is actually going to end up attaching to the skull, but they're not showing the skull right there. So that's amazing. That was discovered by accident, and we've been dissecting bodies for a couple hundred years for Western medicine, and we didn't even realize that. So go ahead. So that's just one source of causing a headache, right? If someone starts pulling on your nerves, it's not going to feel good. It's not going to tickle, so it probably causes headaches. That's just one new source that we've kind of discovered. So if we remove all the layers of the muscles, what you see here on the left is the nerves in some relation to the vertebra, the bones in the neck. So you can see these nerves coming out, which says C1 vertebra. Basically, if you look around there and below, you see nerves coming out from the spinal cord, and then they go up the head. So if you guys ever hit your funny bone and then you feel it zing to your pinky, so what if you're hitting that nerve? It's going to zing to your head, and if you keep doing that, it's going to keep throbbing. And you can see here, and they're very intimate, the nerves with the joints. And so they can get irritated, and if it's getting irritated, it's going to tell you by causing a headache, basically. Okay, let's go to the next.